watching Aheisibwe, empowering you. Aheisibwe. You're watching Aheisibwe, empowering you.
You're welcome to the Health and Lifestyle Hour at Aheisibwe. I'm Dr. Aheisibwe. I'm an obstetrician and a gynecologist. I'm also a fertility specialist at Neocare Clinic and Fertility Centre-Mbarara. Today's topic is about getting pregnant at 40 years and above. For a number of women, getting pregnant at 40 years and above is what will happen, just because of a number of reasons that may include getting married at around that age, or having been in a number of relationships and maybe they're in a new relationship where they wish to have children. But also for a majority others, they have been trying to conceive since they got married and now they have clocked 40 years and they feel age is catching up, nothing is happening. 10 years, 20 years down the road, with failure to get pregnant in their marriages. So the major purpose of this discussion today is directed at our patients out there, at all of you viewing this program, because the women above 40 years and above need everyone's support. They need your support. They need the support from their doctors. They need the support from their partners, and they need support from their families. Because as we are going to see, it is not a walk in the park. Getting pregnant at 40 years and above is possible. Perhaps every one of us knows someone out there who has got pregnant in their 40s. Even more interesting, every one of us here or there knows there is someone who has got pregnant even in their 50s. The major purpose of our discussions today is to tell you that yes, it is possible women can get pregnant at 40 years and above. But here we are looking at what are the odds, what are the chances. For a girl or a woman in their 20s, their chances per cycle or per month, their chances of getting pregnant are up to 25%. But for the women at 40 years and above, their chances of getting pregnant in every cycle lower down to only 5%. Now, I want us to agree that there is a very significant difference between 5% and 25%. This is when there is no intervention from a fertility specialist, no intervention that may enhance getting pregnant. Therefore, our message today for the women who have clocked 40 years and they are trying to conceive. If you have been trying to conceive over time, 3 years, 10 years, and you're now 40, it is perhaps time to get to the next, to escalate. It's the time to escalate, get to the next level of care. You cannot continue doing things the same way and expect different results. If you have not yet visited a fertility specialist and you have been trying to conceive and you're now 40 years, the time is now. The time is today to visit a fertility specialist and see what could be wrong. If you are newly married, people choose to get married because of a number of reasons, because of what they have been up to, what they have been doing, and maybe the opportunities that have come along the way. So for those who have got married at 40 years and above, perhaps the right things to do is don't wait for so long. If it is 3 months, 4 months, maximum 6 months, and you have not yet conceived, it's the right time to visit a fertility specialist. Now, when you visit a fertility doctor, there are a number of tests they are going to carry out. One of them is a test that determines your ovarian reserve. And it's now widely accepted that the anti-Müllerian hormone is a good marker and an accurate marker of ovarian reserve. A number of centers love to do the anti-Müllerian hormone together with a transvaginal scan, because through the transvaginal scan we're also able to see the number of follicles and therefore can have an idea about one's ovarian reserve. So the fact is that at age 40, one's ovarian reserve, or the number of eggs, the number of good eggs when one crosses 40 years reduces. We know that at birth, every girl is born with between 2 to 3 million eggs. By the time they go into puberty, then we are left with between 200 to 300 eggs. So imagine from 2 million to 200 to 300 eggs. And also know that almost every week, one loses about 30 eggs. Any woman in their reproductive age will lose about 30 eggs almost every week, every time. Now, with those eggs, we know that those eggs which may not be good, some eggs are real bad. They will be unable to grow, they will undergo atresia, or I can say they may say melt away. I don't know how best to put it in a simpler way, but we may lose some eggs along the way, such that the peak for one's fertility will be around 35 years. After 35 years, the graph starts falling. And then when one clocks 40, as we approach menopause, which we know is in the range of 45 to 55, then their chances of getting pregnant keep dwindling. Now, in the world out there, and in our experience at Neocare Clinic and Fertility Center, we tend to see more women who have grown old being the ones trying to seek fertility services, because they have tried a number of places and things haven't worked. Fertility services, being where they are, take time. Sometimes they are not available everywhere, and we see people who have been seeking care since as long ago as 1997. People have been trying to get pregnant, 2003, and these are the people who are now in their 40s. So keeping in mind that the people who come now will be 40 years and above, after either trying to conceive for a long time and failing, but also after, for those who have been newly married, after finding their missing rib finally, then at age 40, one has to act immediately, as we have seen, quickly have of their ovarian reserve determined by visiting a fertility specialist. And we have seen how the ovarian reserve is determined. Usually, the doctor should be able to guide on the approach to treatment. If there are still some follicles, if there are still a good number of eggs, then one can give medicines to stimulate these eggs and advise on timed sexual intercourse to increase the chances of conception. But in those where the ovarian reserve has declined, where the number of eggs and the quality of eggs have declined, then that is the point where decisions on assisted reproductive technologies can be made. So I want the women out there to know that yes, you can get pregnant naturally at 40 years and above, but your chances of getting pregnant are as low as 5% compared to those women in their 20s. And for those who have been trying, you don't have the luxury, you don't have the liberty to wait so as to be able to get pregnant naturally. So at age 40, if anyone has those desires, then that's the right time to see a doctor. At 40 years, we also know that that's the time when a number of challenges, a number of chronic diseases have set in. Conditions like hypertension, conditions like diabetes, and that's the time even where libido has really gone lower. We know that all these factors have an effect on one's fertility. Of course, it's better if one doesn't cross 40 before they conceive. But for those who are not fortunate enough to have children, at 40, you must get out of your comfort zone. In addition to prayer, and the prayer in this case, you are not asking for a miracle. You're asking God to show you the right doctor. You are asking God to show you the right investigations so that whatever is done is able to help you achieve a pregnancy very, very quickly. At 40, for some, that's when they have already had fibroids. At 40, a number of health-related complications have happened. So, what happens now when you get pregnant, if you're lucky and you're pregnant at 40 years? Yes, we know that the chances of miscarriage are higher at that point. We also know that the chances of having other complications like antepartum hemorrhage, miscarriages at any stage in the pregnancy are higher. IUFDs are higher. So one has to again make sure that they are being monitored, they are being seen by a qualified medical doctor, preferably an obstetrician and gynecologist. Now, there are those women in their 40s who are in long distance marriages or relationships, where a man works in Dubai, the man is studying a course in America, but the woman is here in Uganda, has been struggling to get pregnant. There should be no compromise, because this woman is not going to get pregnant unless she meets the partner. Radical decisions must be taken. Radical decisions must be made, including organizing, if the worst comes to the worst, grand meetings to ensure that the husbands are surely put on board, know the need for their partner to get pregnant. Because whereas a man in his 70s, in his 80s can father a pregnancy, it is very difficult for women at 40 years and above, as we have seen. So our dear women, our sisters, relatives, if you're 40 years and above and you still have fertility desires, you still urgently wish to get pregnant, visit the specialist nearest to you for the services, because I don't want to see you heartbroken. I don't want to see you devastated. In this discussion that we've had, we've talked about the facts that yes, you can conceive. I've talked about the figures, that actually your chances of getting pregnant naturally at that age is only 5% compared to 25%. We've also discussed a number of fallacies. The fallacies are that yes, we can wait upon a miracle to happen. The fallacies that you can keep doing things the same way but expect different results. And we really believe that if any one of us has watched this discussion, please share with the person that you care about that is in the age range that I've talked about, so they seek the service whenever they can. As already noted, that the older women, yes, are coming to the hospitals. There are a number of challenges. Perhaps those in their lower age groups, in their 20s, 30s, don't have capacity for a number of assisted reproductive technologies to be performed on them. But usually by 40, people have reached somewhere. They're able to have something. They can have an IVF done. They can have an intrauterine insemination done. So that is the opportunity that one has to seize. Thank you.